Muse, and I'm a student of University of New England. My project proposal is about reducing infant mortality rates in Louisiana State, and I'm presenting it to the Bureau of Health Director. The infant mortality rates in Louisiana State, the problem statement. Overall, the problem of high infant rates in Louisiana is brought about by the high rates of preterm births. Preterm births is a complex problem with no single solution. About 380,000 babies are born prematurely every year in the United States. These infants are at greater risk for death and are more likely to suffer long life illnesses. Surprisingly, in about half of the cases, the cause is unknown. The national average rate of preterm births is 11%. Furthermore, Louisiana has the highest rate of preterm births, whereby 15% of all children born in Louisiana are born before 37 weeks. Consequently, the state has the highest infant mortality in the nation as a result of high rates of preterm babies. In Louisiana, 8.9 of every 1,000 babies born die before their first birthday. In 2013 alone, the CDC report indicated that the percentage rate of preterm births are highest among the minority groups, the highest percentage rate being among the blacks with 15.7%, Native Americans with 2.7%, white with 10.7%, are lowest among the Spanish with 8.8%. Neighbors like Holy Grove in New Orleans have been more affected. Nearly 19% of babies born in Holy Grove between 2006 and 2010 weighed less than 5.5 pounds at birth, while the normal weight is 7.5 pounds. Risk factors contributing to the high rates of preterm births in the state include high rates of pregnant mothers who smoke, excessive drinking, high obesity rates, poverty, and high violent crime rates that have been linked to high numbers of preterm births in the state. The possible approach to lowering preterm birth rates is to examine how they relate to race, ethnicity, and SES. The federal government has to expand Medicaid eligibility, build state-level programs that enhance prenatal visits, and enhance smoking cessation programs for pregnant mothers in order to improve outcomes. Preterm births. Preterm babies are babies born before 37 weeks. The babies are not physically ready to leave the womb, so they are prone to infections. These newborns have higher chances of disability and even death. African Americans and Native Americans have the highest neonatal death rate associated with prematurity. The problem of giving birth to preterm babies is determined by more than the genetic makeup of the mother and the lifestyle choices that they make. While both play a role in health outcomes, they are also structural and social forces in a person's life which they may have little control over that impact health outcomes. The high rates of preterm babies are impacted by each level of society. Each of these levels is described in the socio-ecological model that include public policy, community or the environment where people live, organizational, interpersonal, and individual. So this model will help us to understand how disparities impact health mortality rates in Louisiana State. Model level and key factors influencing preterm births. At the individual level, mothers with high education are more likely to seek for prenatal and postnatal services. And smoking during the other factor that influence preterm birth is smoking during pregnancy and within the infant's environment, 22% of the Louisiana women between 18 to 44 years smoke, and smoke is linked to premature death. At the interpersonal level, intimate and supportive male partners will help with better health outcomes. And little paternal support increases the risk of preterm birth. At organizational level, increased eligibility for Medicaid for all will improve access to prenatal and postnatal services and eventually better health outcomes for mothers and the infants. However, expensive insurance plan will hinder access to prenatal and postnatal services, which would otherwise help reduce the high rates of preterm babies in the United States. At the community level, access to health foods helps with better birth outcomes. Optimal birth outcomes are dependent upon the availability and intake of sufficient nutrients. And extremely poor neighborhoods will promote poor access to community services, since there is an association between poverty and preterm babies. At policy level, increased public health funding on prenatal and postnatal care services will influence health outcomes, while lack of insurance, like we see in Louisiana, 28% of the entire population of women of childbearing age do not have health insurance, so that hinders the whole process of health outcomes. After thorough research, intervention strategies were identified to reduce preterm births. And one of them is promoting smoking cessation during pregnancy. Smoking during pregnancy increases the risk of prenatal births. So further success to reduce prenatal births will involve having all health workers in contact with pregnant mothers complete a one-on-one education counseling session to give specific quitting information. The second intervention would be to increase prenatal visits. To appropriately monitor mothers and the baby's health, and also to screen the mothers and the baby for any health risks associated with the pregnancy. All pregnant mothers must attend all prenatal visits as described by the health workers. The other intervention strategy that could reduce preterm births is increased Medicaid coverage. We realize that poverty is one of the risk factors for preterm births. So in order to reduce preterm births, it's important that the government increases Medicaid coverage. This will allow more pregnant mothers without health insurance apply to enroll in Medicaid insurance in order to access care before and after pregnancy. Affordable health insurance for all will improve access to prenatal and postnatal services and eventually better health outcomes for mothers and their infants. Also, increased access to health food will produce optimal birth outcomes, because optimal birth outcomes are dependent upon the availability and intake of sufficient nutrients. We are all aware that evaluation of projects is very important, and usually it's an ongoing process, or some people do it at the end of the project. So in order to assess the success of my project of reducing prenatal births in Louisiana, first of all, success will be measured on the increased numbers of pregnant mothers and caregivers consistently adhering to quit smoking messages after the intervention. So at least 10% of pregnant mothers who receive quitting counseling sessions every year will be a success in this project. Success will also be measured on the number of women screened to determine the risks of the fetus and the mother after the intervention. So if at least 1 million pregnant mothers attend prenatal care in the United States, this will eliminate untreated and undiagnosed pregnancy-related diseases. And if this is done, the project will be considered a success. Success of the project will also be measured upon healthy babies and mothers irrespective of SES. We shall consider an increase of 10% of pregnant mothers of low-income status as accessing preventive services for infants and mothers in the United States through Medicaid insurance based after the intervention. The potential challenges or barriers are likely to hinder the success of the interventions of the project is while health professionals are engaged in providing smoking cessation support, their role could act as a barrier to an individual's ability to stop smoking. A poor professional client-patient relationship in any interaction is considered as a barrier to addressing and supporting smoking cessation success. Expansion of Medicaid eligibility can be a major benefit for removing a primary barrier to receiving health care, but it rarely solves all access problems. There are shortages of healthcare providers, especially private physicians, in many communities occupied by a high concentration of low-income people. Furthermore, Medicaid does little to overcome barriers such as transportation costs or difficulty. Cultural differences between health providers and potential clients could also be another barrier to access to care. The reason why women do not obtain prenatal care, even when it is available and accessible, are complex. Structural barriers including not knowing where to go for prenatal care, having a long wait to get an appointment, and having problems with child care or transportation can hinder access to care. Yet receiving incentives and getting help with transportation and child care would have facilitated mother's attendance at prenatal care visits. Like we say, every problem has a possible solution. One of the solutions to the problems that may hinder or challenges that may hinder better services for mothers would be the potential solution to some of those problems would be effective communication system between clients and healthcare providers, which has been identified as one of the ways to improve birth outcomes. Since further success to overcome preterm births will involve educating and counseling mothers to quit smoking, creating an effective patient-provider relationship will help to improve health outcomes. Also, closing the gaps that hinder access to care, like lack of transportation by the clients,